So for my leadership skills questionnaire, I had 25 points for administrative, 23 for interpersonal, and 19 for conceptual. So I see those skills reflected in the fact that I love to take initiative and solve problems. I guess that's the administrative side of me. But I also really like teamwork, and I think that you can get things done better and more efficiently if you work together, disperse the work, and have people focusing on certain areas that they are specialized in. I'm also not afraid to be assertive, so like if I see that somebody's doing something that's not very time or cost effective, I will let them know and I will help them realize the way they should be doing it and why that's the best way. I like to provide education as to why somebody should be doing something one way as opposed to the other. But I definitely think input from staff is very important when you're a manager. The staff seem to know kind of what's going on best, especially in healthcare on the floor, what the needs are and stuff. So with that in mind, I think the horizontal structure is probably the best for me as a manager. I believe if you just have like the hierarchical management, they don't really have a very specialized manager for each position. So as I was reading, I believe it was in the book, it had stated how many units it took or a patient went through when they went in to have surgery and then to post-operative care. And a manager of surgical services is going to have a different sort of managerial style than a manager of a floor. There's different needs, different ways the unit works, and so I believe the horizontal structure works better because it disperses authority. So that would definitely be the horizontal structure, not vertical. I think a bureaucracy sort of management would be okay in like a code situation where you need somebody to tell you what to do, but I think a horizontal structure in healthcare is the best because it listens to people's opinions and incorporates more ideas, and it's not so set in stone one direction. So it says the main functions of a manager are organizing. It starts with planning, organizing, staffing, directing, coordinating, controlling. I thought evaluating was in there somewhere, but I guess not. So for planning as a manager, I would say I do a pretty good job at seeing what needs to be done and figuring out the best way to go about correcting or accomplishing what needs to be done. But I do think it's important for managers to have staff meetings like monthly or so to get ideas about what needs to be done, what needs to change, what's working well. So if I were a manager and planning, I would definitely bring up things that I think needed to be done in ways that could change them, and then I would mention that to my staff and see how they felt about that. Organizing, as I said, I like the horizontal differentiation because I think one person can't be the best manager for all different types of units, as in surgical services and an inpatient floor. So it said, at the unit level, the manager maintains the structure that facilitates nursing care. So after reading the different types of nursing care delivery models, I believe the case management would be the best delivery model for nursing care, just because it incorporates all these people that are within the healthcare team that have the many different talents and specialties focused on benefiting the patient the most and giving the patient what they want and what they need. So for my article that I chose, it is called Creating a Culture for Interdisciplinary Collaborative Professional Practice, and it's by Orchard, Curran, and Cabine. So this article is basically just stating how interdisciplinary collaborative practice in the hospital works best for patient outcomes, patient cares. They stated a partnership between a team of health professionals and a client and a participatory, collaborative, and coordinated approach to shared decision-making around health issues is the best way to go about healthcare. As I was saying, I think the organization is best when you do the horizontal differentiation. And in this article, it stated that leadership and handling of conflicts within healthcare teams are the most critical elements to their success. Leadership should reflect non-hierarchical relationships between the professions with an equitable distribution of work, authority, responsibility, and credit for success. Then it later states that interdisciplinary teamwork leadership is not constant, as no one leader can provide all the leadership in any complex situation. So that's just saying that splitting up the tasks to the person who is specialized in that area is going to work best and going to provide you with the best results. For staffing, I'm a firm believer that the manager should speak to the nurses who are on the floor, the ones working every day, and get ideas about how they feel the staffing ratios are, how to judge the patient acuity and determine if you have a patient of this acuity, you should only have this many patients. So I believe that the manager definitely needs to take a more democratic approach when figuring out staffing, because the manager is not on the floor as a staff nurse caring for the patients. So it's really important to include your staff nurses and the people that are a little bit lower but doing the work on the floor. So directing is extremely important. When you need something, you need to ask for it. You can't be scared. And I think if I were to become a new manager, that would be one of the hardest things, is because I would be afraid to direct people who didn't have full trust and respect for me as a manager at the moment. But directing is broken down into giving directions, supervising, leading, motivating, and communicating. So I think I do a really good job of telling people what needs to be done and congratulating them or thanking them and telling them they did a good job. Or if I see that somebody needs a little more direction, I'm not too scared to push them and help them and educate them on ways that they could be doing something better. And I also have kind of the trust in my coworkers that they're going to do what needs to be done. I'm not going to hover over them making sure that everything is done, because managers don't have time for that. They need to trust that their staff are going to be able to carry out the tasks that are supposed to be carried out by them. So I do think it's important that for a manager to evaluate and see how their staff are accomplishing tasks, what they're doing, and giving them that extra nudge or budge if they need to pick it up. So motivating, I do think it's important to form good bonds with your staff. Not necessarily buddy-buddy, you don't have to be best friends with them, but I do think it's good for them to know that you're there, you want to listen to them and you care what their opinions are. And then communicating, so incredibly important. And that's why I like the horizontal structure of management, because I think communicating is a lot easier. There's less hoops to go through for staff to communicate to their manager. So if they're heard more, their opinions are heard more, and things can be completed easier because it's not being sent through so many different levels of management. So as I mentioned, I like the interdisciplinary care, the case management, working with your case managers, your physicians, your social service or social workers, rehabilitation, the nurses, the charge nurses, the managers, to give the patient all that they need and get them out the door and on their way to doing what they need to do. So I think that's about it. I'm not sure what else I need to include, but just to kind of sum it all up, I do believe I've got the administrative and interpersonal skills. Those are my two highest. So I think I'm very good at collaborating with my coworkers, talking to them, communicating, and getting a feel of what needs to be done, but then also being able to take that next step and be assertive and say, we need to do this, and this is why, and just helping everybody understand why we're doing certain things. So I like the horizontal model of management, just breaking up the work into different groups who are more efficient, and they're going to be able to work better just because they're focused on one thing and not trying to do so many different things, as in the manager who's focused on your surgical services, and then you've got a manager who's focused on inpatient units. So you can kind of look at those two different needs separately and determine which works better for one and which works better for the other. And I like the case management model of nursing just because, as I said, that breaks up all of the responsibilities to the appropriate personnel, and I think it comes with the best effective outcome for the patient. And for my article, I chose one that had to do with establishing interdisciplinary collaborative professional practice. And this basically stated that not one person can be a leader over everything, because there's going to be people who are extremely creative, people who are really good problem solvers, and you kind of need to have those people split up to do what they're going to do best, not just one person covering everything. So I hope I answered all the questions, and thanks.